This is almost like we're almost in the golden hour here for photography and video. It's the sunrise and sunset hour where the light is the most golden and you got the best shadows, so it looks the best. Ta-da. Welcome back, comrades. Who's ready for their kids to be back in school yet? Anyways, here we are coming up on the end of summer. If you haven't made it up to the cabin or out on the river yet, better make some plans soon, because Labor Day is right around the corner. Speaking of Labor Day, let's get right to work. We've got part 2 of our back safety topic, wound packing and the Stop the Bleed campaign, and a warm welcome to our new EMS fellow, Dr. Liz Robinson. So turn down your radios, put yourself out of service, and grab some coffee, because I'm Dr. Peterson, and coming up are the 3 things you need to know. Last month we met up with Jeff Carlson to talk about healthy backs. What you saw in the video was just a small piece of the knowledge that he dropped on us that day. Jeff has done his homework and is definitely an expert when it comes to back health for public safety professionals. If you haven't seen last month's video, Jeff gave us some basic theory on back stress and showed some simple things you can do, like adjusting the seat in your ambulance, to reduce the fatigue on your back throughout the day and reduce the risk of an injury. But let's face it, lifting is a part of your job. Sure, some of you have access to power lift cots and power load systems so you don't have to lift on every call, but those patients don't always get up from the floor on their own, so it's inevitable you'll eventually have to lift someone. This month, let's talk about the actual lifting process and how you can optimize your technique to reduce your risk of injury. So Jeff, tell us what we need to know.
When it comes to lifting the backboard, it's important to make sure that we're positioning ourselves properly. If the tendency is to come in and square up with your feet next to each other here and come down, we're already at a disadvantage, especially if we're on ground that's slick or unsteady. In this body position, my partner may inadvertently push me out of position and set me up for low back issue. Let's have you try this. Bring yourself into this body position here. When you're in this position, you're going to feel a lot of stress up to the shoulder and in the back, and we all agree there's nothing good about this body posture. But take one foot and slide it back until you feel the stress go from your shoulder to your shoulder blades. And that body position now, your core is firing. So as you come up to the board, set your foot up across. Your hand should be about the ball of your foot. And this body position, I'm stronger. If my tendency is to be here and I bring my knees past 90 degrees, I lose 70% of my quad strength, and again, my balance is off. When I bring my foot forward, set up on the ball of my foot, now I'm in a better posture. I have 6 to 18 inches of sway here where I'm still firing the core and reducing my injury risk by 70%. So let's have you try that. We'll bring one foot forward, get yourself set. We'll bring your hand down, and on the count of 3, you take the call.
1, 2, 3.
We come up, and we see you keep your core nice and engaged. That was perfect. You both were working together. You didn't feel any push off. That looked great. Let's have you bring it back down. The goal is to create a habit. When you can use a 1 foot forward, thumbs up body position, whether it's doing lifting or working with patients, you're engaging your core, you can reduce your injury risk to your back by 70% or more. Another aspect of protecting your back is strengthening. At age 30, we start to lose strength, power, and endurance. And if we don't do something to help ourselves, we just continue to lose that fatigue resistance. A couple of easy exercises you do from a chair just uses a stretchy band. The first one works on your back extensors. So just scoot forward in the chair, take the band, bring it under your feet, bring it to chest level, keep the inward curve in your back set as you bring yourself forward, and then extend back. It's like doing the old Roman chair exercise. We start here, keep that inward curve in your back as you come through. Keep your head up, keep your shoulders back. The goal is 45 repetitions. If you do this exercise twice a week, it resets the back and helps your brain understand where neutral is. The second exercise, we take the band, bring it around the back of the chair, bring it to the chest, hold snug, and again, keeping the inward curve in your back, come forward to do a crunch exercise. Come back past neutral and repeat. The goal again is 45 repetitions twice a week. Now you may need to start at 3 sets of 15 perhaps and move up to 45, but the goal is to keep working on that to improve your fatigue resistance. A third exercise that gets the core working together is just called a step down. We stand on one foot, bring your foot forward. Make sure that your toes are pointing forward on the foot on which you're standing to keep your core engaged. We start here, lower down until your heel hits the ground. The goal is to be able to do 45 of these again. This is going to work on your strength, your balance, and your endurance. Slip and fall is a significant factor in EMS injuries and firefighter injuries, so this is going to help reduce that. Switch to the other foot. Again, bring the foot forward, come down into your kneecap. Lines up with your middle toe, hit your heel, keep that core engaged.
Since the resurgence of tourniquets several years ago, we've seen several evolutions in their use. Most recently, you've likely heard of the Stop the Bleed campaign, which is a national campaign to empower anyone to use a tourniquet if they encounter someone with massive bleeding from an extremity. All of the different messages that we hear can be confusing. Stop the Bleed teaches placing the tourniquet 4 to 6 inches above the wound on an extremity, whereas the military and other tactical EMS groups have gone with high and tight philosophy. Let's clear the air. Here's what you need to know. Clinical studies have shown improvements in patient survival when tourniquets are placed for control of major limb hemorrhage. When they're placed prior to the patient reaching a state of decompensated shock, the survival rates are as high as 90%. If the tourniquet is placed after the patient begins to decompensate, survival is only as high as about 10%. At Regions, our goal is to place the tourniquet above the elbow or knee on a single bone at least 2 inches above the site of injury. Nobody's going to stop you if you choose to go high and tight, especially if you can't quickly figure out exactly where the wound is. Significant military experience has shown that applying a tourniquet as distally as possible above the wound on a single bone is just as effective in stopping an arterial bleed and allows blood to continue to flow to a bigger portion of the uninjured part of the extremity. This may be basic for some of you, but this is a critical life-saving skill that we should all be able to do upside down in the dark while half asleep. Check this out.
Hey guys, we're going to talk over the Combat Application Tourniquet, or CAT tourniquet, buddy application routed. First thing you want to do is take the tourniquet, route it underneath the leg, making sure to get it as high as possible on the injured extremity. Route it through the friction adapter. Tighten as much as possible. Secure the Velcro to the Velcro strap. Use the tightening rod to tighten down on the tourniquet until the bleeding has stopped. Secure the tightening rod in the securing clips. Check pulse to make sure bleeding has been controlled. Once confirmed, use the safety strap to secure the tightening rod. And don't forget to mark time.
Now, I know what you're thinking. So doc, what if the wound is too high for a tourniquet, like the groin or the shoulder? Well, that's a great question and very timely for those of you attending Regions EMS CME this quarter. Although it's something we don't regularly mention, wound packing is another hemorrhage control skill that all EMS professionals should be able to do. It is most effective for treating wounds high up on an extremity that you can't get a tourniquet placed over. Let's watch another quick video to demonstrate wound packing. And keep in mind that Kerlix gauze works just fine if you don't have combat gauze available. Also, just wear gloves. You'll see what I mean.
Hi folks, Zach here. We're going to be going over wound packing today. The Committee on TCCC approves 3 types of hemostatic gauze: combat gauze, Celox gauze, and Chita gauze. Once you have identified a wound, hold pressure, direct pressure, and expose that wound. Go ahead and try to identify the major bleeder or any other bleeds within that wound. We're going to hold pressure on that wound. Open up your combat gauze, make a small ball. 1 for 1, replace the finger that's holding pressure against the bleed until you've packed that entire cavity. Again, 1 for 1, maintaining pressure while you're packing and ensuring that blood isn't seeping through or around the combat gauze as you're packing it. You're going to continue to pack, maintaining pressure the entire time you're packing. Once you've packed the entire wound, hold pressure over the wound, ensuring that blood isn't seeping around or through the combat gauze. Hold pressure for 3 minutes. Once the 3 minutes is up, and it's time for a pressure dressing.
The critical first step in wound packing is that you need to place strong pressure directly on the point of injury. Don't just squash the entire wound with your hand. Dig in there and stop the bleeding. And hold that pressure for several minutes until it stops. The little ball that you make in the end of the gauze roll is to give you a firm starting point to maintain that pressure. Once you start stuffing gauze, continue to hold pressure as constantly and consistently as possible. There should not be any additional bleeding from the wound when you're done. If there is, you missed something. Go back in and pack it tighter. These patients are the people that you can save. Like I mentioned earlier, whether your patient lands in the 10% survival group or the 90% survival group depends 100% on the treatments provided before they get to a hospital. So some of you have probably interacted with Dr. Abe Campos, our EMS fellow. Well, it's been a year since Abe started his training with us, and to be honest, I haven't really seen him around much in the last few weeks. But I see another Regions EMS vehicle here at St. Paul Fire Station 1. So let's go check in with him and see how things are going. Abe! Dr. Campos! Abe? Hey, you look like you work here. Have you seen Dr. Campos?
He stopped working here a month ago.
But isn't that his truck out front?
It's my truck now. I'm Liz Robinson. I'm the new EMS fellow.
So we'll get to know Liz better in a minute. But before we do that, I want to take an opportunity to thank Dr. Abe Campos for his enthusiasm and contributions to our medical direction team during his fellowship training over the last year. Dr. Campos completed his training and has moved back to Omaha, where he will join the EMS medical direction team at the University of Nebraska Medical Center. Abe, we wish you well in Omaha, and thanks for the memories. Lucky for us, though, life goes on, and we're fortunate to have Dr. Elizabeth Robinson join our team as our new EMS fellow for the next 12 months. Liz, first of all, welcome.
Thank you.
But also, what do we need to know about you?
Well, I went to medical school in Madison and just finished my emergency medicine residency at Hennepin County, now Hennepin Healthcare. And I play rugby.
Play rugby, wow. So are you more of a Miller or a Mac person?
Mac.
Why?
I think that's maybe just what I'm most comfortable with, but also the curvature just makes more sense to me.
All right, I'll ask that again and then just say Mac. That's what Abe said last year. He's like, Mac, I'm all about the curve. So are you more of a Miller or a Mac person?
A Mac person.
And why?
All about the curve as well.
All right, let's try that again.
Does make sense.
Just say Mac.
Mac.
The curve makes sense to me. Or
Okay.
just something like that.
Okay.
So are you more of a Miller or a Mac person?
Mac. The curve just makes more sense to me.
Perfect. Let's see what else I can ask. So what's one thing you're looking forward to this year in your training?
I'm really looking forward to getting out of the hospital and into the pre-hospital setting and working with kind of a multitude of different providers.
Excellent. So what have you already found out about St. Paul that's better than Minneapolis?
Oh, man.
All right.
Someone has to help me with an answer here. The Costco. The Costco is better.
Costco.
I mean, obviously Regions.
Costco, construction, and kayaking.
Perfect.
This is just awkward.
Like deeply uncomfortable.
Yeah.
Love talking about myself on camera.
So Liz, now that you've been here for a few weeks, what have you already noticed about the East Metro that's so much better than the West Metro?
Costco, kayaking, and less construction.
Perfect. So what got you interested in EMS to begin with?
So I basically grew up on the back of an ambulance. My dad was a medical director and my mom rode on the ambulance from my hometown. And so when they had calls, I'd pick up my crayon box and they would drive me to the station and I'd sit with the dispatch until they got back.
So what's your favorite state fair food that you're looking forward to?
Anything that's deep fried.
So anything at the state fair?
Yeah.
Okay, perfect. So Liz, why don't you tell me what you anticipate your schedule looking like for the next year? So
for the next couple months, I'll be visiting with all of the St. Paul fire departments, as well as moving out into the rural and western Wisconsin pre-hospital EMS systems, as well as working as an ER doctor at Regions and some Valley hospitals in western Wisconsin.
Great. Hopefully many of you will have the chance to interact with Liz over the next year as she makes her rounds. And depending on your county, you'll know her as either Car 95 or Regions 874. She's got some great enthusiasm and a good understanding of our local practice already. And she's an authorized medical director. So be nice, learn something from her, and maybe teach her a thing or two. That's it. That about does it for August. We'll see you next month for more exciting escapades. But between now and then, come say hi to us at the Minnesota State Fair. Our Regions EMS event medicine team will be curing all sorts of ailments at our 2 medical aid stations. So stop on by to grab some free water and drop off a bag or 2 of mini donuts. We'll even welcome you if you're from Wisconsin, because after all, football season hasn't started yet. Thanks for watching. From Regions EMS, I'm Dr. Peterson. And until next month, stay smart, stay safe, and stay professional.